Before Florence Nightingale, hospitals were dirty, deadly, and terrifying. Soldiers feared the ward more than the battlefield. But one woman known as the Lady with the Lamp turned chaos into order and saved thousands of lives. Tonight, we uncover 5 shocking ways Florence Nightingale changed medicine forever. Please like and subscribe. Hospitals were death traps before her. Imagine stepping into a 19th century hospital. Instead of healing, you're hit with the stench of rot, overflowing sewage, and patients packed together like cattle. Bed sheets weren't washed, sometimes they weren't even changed between patients. Surgeons wore blood-stained coats like trophies, and sterilization wasn't even a word in medicine yet. Here's the shocking part. Soldiers often had a higher chance of dying in the hospital than on the battlefield. Wounds that should have healed quickly turned deadly because of infection. In fact, Florence Nightingale discovered that more men were dying from disease and filthy conditions than from their actual battle injuries. This was her earth-shattering realization: hospitals weren't places of healing. They were death traps. And that brings us to her most powerful weapon. Florence didn't fight death with fancy medicine or new drugs. She fought it with something so simple, it shocked the entire medical world: soap, water, and sanitation. Because what happened next was nothing short of a revolution. Florence Nightingale transformed hospitals from cesspools of death into centers of survival. She revolutionized hospital sanitation. A military ward full of wounded men. The air is thick with damp, the floor slick with unknown fluids, windows stuffed shut to keep out the cold, and every cough, every dressing change spreads sickness like wildfire. This wasn't chaos by accident. It was the system. Hospitals were designed the wrong way. They amplified disease instead of stopping it. Florence saw that and acted like a detective. She walked the wards at night. She mapped the smells, the traffic of people, the flow of waste. Then she attacked the problem with simple, stubborn logic. Bad air and filth, more disease. So she rewired the hospital's priorities. What she changed first was boring, and that's exactly why it worked. She insisted on clean bedding, changed regularly, no more reused, blood-stained sheets, daily scrubbing of floors and surfaces, proper disposal of human waste, sewage systems where there were none, and open windows and better ventilation, so stale, infection-laden air couldn't hang over beds. Sounds basic? That was the point. Small, disciplined rituals became weapons against death. The results were brutal and immediate. In some war hospitals, mortality rates plunged from about 42% down to just 2% after her reforms. That number isn't a rounding error, it's a miracle achieved by mops, buckets, and order. She didn't stop at cleaning lists. Florence reorganized how space was used, separating the sick from the contagious, spacing out beds so germs didn't leap from cot to cot, and demanding nurses follow strict cleaning schedules. She taught officers that architecture mattered: ward layout, drainage, even where a window sat could change life or death outcomes. And of course, resistance came. Many thought she was wasting time with housekeeping. They called it petty. But Nightingale proved that prevention beats cure. Clean wards meant fewer infections. Fewer infections meant fewer deaths. Simple as that. But here's the twist. Cleaning alone wasn't her final play. Florence didn't just scrub wards. She turned those scrubbed wards into training grounds. Next up, how she turned nursing from lowly labor into a respected professional force that could carry her sanitation revolution around the world. Founder of modern nursing. Think nursing was always a respected career? Think again. In mid-19th century Britain, nursing often meant untrained help women picked up from workhouses or inns, doing dirty, exhausting tasks with no instruction. Some nurses were kind and heroic. Many more were sloppy, incompetent, or treated the job like a last resort. Hospitals expected little, patients got less. Enter Florence Nightingale. She didn't just clean wards, she rewired the idea of care itself. In 1859, she published Notes on Nursing, a short book that read like a manual and a manifesto. Simple rules on ventilation, diet, observation, and the human touch. Then in 1860, she opened the Nightingale Training School at St. Thomas's Hospital. This wasn't charity, it was professionalization. What did that look like on the ground? Rigorous selection. She insisted on recruiting women of good character and basic education, not because she was elitist, but because she knew respectability would lift the job's public image. Classroom bedside, nurses learned theory in lectures and immediately practiced it in wards. Lessons weren't just how to wash, they covered how to observe a patient, record changes, and communicate with doctors. Standards and discipline, schedules, clean uniforms, strict hygiene, and a chain of command made nursing efficient and reliable. No more hit-or-miss caretaking. A moral and scientific code. Nightingale fused empathy with evidence. She demanded compassion, yes, but also careful measurement and documentation. The effect? The role of the nurse shifted from anonymous labor to skilled vocation. Her graduates left St. Thomas's and became matrons, supervisors, and reformers, spreading those standards to other hospitals, army barracks, and even different countries. Suddenly, hospitals that adopted trained nurses saw better recovery rates not because of new drugs, but because care had been upgraded into a repeatable, teachable skill. And here's the kicker. Nightingale didn't stop at training hands, she trained eyes and minds. She taught nurses to watch closely, to note patterns, to keep records. Those records became proof. Those proofs became policy. So while she was building a new profession, she was also building an army of observers, people who could collect the data she needed to argue for sweeping change. Next, how Nightingale turned those notes and nursing records into hard numbers that forced governments to act. She used data to save lives. Numbers don't feel dramatic until they decide who lives and who dies. Florence Nightingale turned quiet columns of numbers into a weapon. She didn't just watch the wards, she counted everything. How many men died, when they died, and why. Then she refused to let those numbers hide in dusty ledgers. Picture her at a small desk, oil lamp burning, turning piles of casualty lists and hospital returns into patterns. She grouped deaths into neat categories: wounds, disease, other, and compared month to month. The result? A pattern that slapped the medical establishment awake. Most deaths were from preventable disease, not battle wounds. But Nightingale didn't stop at the tables. She made the data impossible to ignore. She invented a new way to show it, the polar area chart, the thing people now call the coxcomb or Nightingale rose. Instead of boring rows of figures, she made wedges and spikes. Each wedge represented a month, and the size showed how many soldiers died of disease versus wounds. You could see the killers: huge swells for preventable illnesses, tiny slices for battle injuries. Politicians and military leaders couldn't shrug at pictures the way they could shrug at numbers. What she achieved with those visuals and the plain reports that accompanied them was threefold. Clarity. Numbers became narrative. The chart told a story at a glance. Credibility. She backed emotional appeals with rigorous evidence. That combination was irresistible to lawmakers. Leverage. With hard proof, she argued for policy changes. Better ventilation, improved sewage, and reorganized hospitals, and the government listened. She also knew how to package data for power. Her reports weren't dry academic papers. They were weapons of persuasion, tightly argued, well-documented, and aimed squarely at decision-makers. She corresponded with statisticians, collected returns from the field, and used every scrap of data to press for reform. The upshot? When she presented her charts and reports, the debate shifted from maybe to must. And the results were immediate and dramatic. Where her reforms were adopted, death rates fell. Where her reports reached Parliament, funding and structural change followed. Numbers changed minds, but Nightingale wanted systems to change the world. Next, we'll see how those charts and reports didn't stop in London. They exported a whole new way of thinking about public health that remade hospitals, armies, and cities across the globe. She changed public health worldwide. Think her work ended at a single ward? Nope. Florence's lamp lit up entire systems, cities, armies, hospitals, and classrooms, and those changes still shape medicine today. Start with the simplest truth. Nightingale's reforms weren't just practical fixes, they were blueprints. She proved that small, repeatable rules, clean water, fresh air, separated wards, trained staff, could be scaled. Once you prove something works in one hospital, governments pay attention. And Florence knew how to make governments pay attention. What she did next was surgical and relentless. She took her nursing graduates, her data, and her reputation straight to the centers of power. She wrote long, blistering reports for Parliament. She advised military officials. She argued with civil engineers and municipal planners about sewage, drainage, and how cities should breathe. The effect wasn't romantic, it was structural. Sewer systems got upgraded, ward layouts were rethought, public health boards started to treat prevention as a policy issue, not a charitable afterthought. Here are the concrete ways her influence spread outward, fast and brutal in its consequences. Hospital design went global. The pavilion layout, separate blocks, long windows, cross ventilation, and space between beds became the new standard. Architects and hospital boards copied it because it worked. Better air, fewer infections, healthier patients. That was Nightingale's fingerprint on architecture. Nursing as exportable power. Her training school didn't just fill St. Thomas's, it produced emissaries. Graduates left for other hospitals, colonies, and countries, carrying a kit of practices, clean uniforms, record-keeping, hand-washing habits, and disciplined routines. Those habits multiplied into whole systems of care. Military medicine reformed. Armies learned to think beyond triage and bandages. Nightingale's influence changed how military hospitals were organized and supplied, lowering avoidable deaths in conflicts that followed. That shift made war medicine less about heroics and more about logistics and sanitation. Public health became policy. Her reports and statistics gave politicians the evidence they needed to fund public works, sewers, cleaner water supplies, and municipal hygiene campaigns. Prevention moved into budgets and law books, not just good intentions. Statistics and surveillance took root. By turning death registers into persuasive visuals, she seeded modern epidemiology. Governments began to collect better health data, the first step toward surveillance systems that can detect and stop outbreaks. And then the world acknowledged it. Her honors, including being singled out by the Crown with the Order of Merit, were more than medals. They were public confirmation that a woman who started by carrying a lamp had reshaped institutions that govern life and death. Why is this shocking? Because one person's insistence on the basics, cleanliness, measurement, training rerouted the course of medicine from firefighting disease to preventing it. Hospitals stopped being places where people went to die and became places where people could get better. Cities stopped treating waste as someone else's problem. Armies learned that logistics matter as much as bravery. What happens next in our story? We've seen the lamp, the mop, the training school, and the charts. In the conclusion, we'll pull all 5 shocks together and answer the big question: which single change of Nightingale's still matters the most today, and why her small rules are the reason modern medicine doesn't look like a death trap anymore. Stay tuned, the ranking will surprise you. Why Florence Nightingale's lamp still lights medicine today. You came for 5 shocks. Here's the one truth that ties them all together. Florence Nightingale didn't save lives with a single grand invention. She saved them by proving that small, disciplined changes, when backed by training and hard evidence, scale into systems that protect millions. Hospitals were death traps, overcrowded, filthy, and killing more than battle. That's the horror she walked into. She cleaned them, not glamour, but clean bedding, ventilation, sewage, and order. Death rates plummeted. She professionalized care, turned nursing into a teachable, respected skill through the Nightingale Training School. She counted the dead, then turned those counts into impossible-to-ignore charts that forced policy change. She exported the fixes: hospital design, public sanitation, military medicine, and the birth of modern public health. What's the through line? Prevention beats panic. Training beats guesswork. Data beats gossip. One woman's lamp illuminated a chain reaction. Tidy wards trained nurses, persuasive numbers policy, and design that stopped disease before it started. That sequence is the backbone of modern medicine, from hand-washing protocols to hospital architecture and national public health systems. Here's the surprising lens. Nightingale's biggest victory wasn't romantic heroism. It was convincing institutions, doctors, governments, architects, to behave like scientists and managers, not just healers. That shift turned medicine from firefighting into foresight. The big question we'll unpack next. Which of these 5 shocks matters the most right now? The sanitation, the training, or the statistics? Which one saved the most lives across centuries? In the next video, we'll rank them and reveal the single change that still shapes hospitals, cities, and pandemics today. You won't expect #1. Which facts shocked you the most? Drop the number in the comments and tell us why. If you learned something that surprised you, hit like, subscribe, and ring the bell so you don't miss the ranking video. Share this with a friend who loves history, though